Hello, my name is Mandy Chittum. This is my self-assessment as a leader PowerPoint. The overview of my leadership journey begins with a background of 22 years in nursing. I started out as a licensed practical nurse, then I had advanced to being a registered nurse and obtaining my Bachelor's of Science. I've cultivated my leadership style, which rooted in the servant leadership, also with transformational influences and adaptive my resilience. My experience spans from physician offices, with being mostly in pediatric and rheumatology clinics, along with community health clinics. I also worked in a rheumatology clinic. I have a significant background in substance abuse treatment centers, along with correctional facilities ranging from regional jails and the Department of Correction prisons. I've also worked in many long-term care settings, along with skilled nursing and rehab. I have worked in community outreach programs. I've also done home health, and I have also done substance abuse centers. Each of these has shaped my leadership and my identity as a nurse, along with not only the physician offices, but also working as a supervisor in the substance abuse clinics. Over the course of my 22 years in nursing, I have cultivated a leadership style that has been rooted in the servant leadership, along with the transformational influence, building on my adaptive resilience. With current leadership traits, we will discuss the servant leadership, the transformational influence, the adaptive resilience, being calm under pressure, and involving team empowerment. With servant leadership, this leads by putting others first, the patients, the colleagues, and the broader care team in general. With my settings in mental health and substance abuse, this means advocating fiercely for our vulnerable patients who may struggle with not only the stigma, but also the systemic barriers. With transformational influence, you have to support your other staff and your peers by mentoring, listening, and modeling compassion. You can prioritize this with emotional and psychological needs of others, even when your resources are stretched beyond your means. With adaptive resilience and this leadership style, you can build trust that fosters the culture with empathy and essential in behavioral health environments. The transformational influence shapes the cultural care by inspiring others to see the deeper purpose in their work. This goes a long way. This gets more on a personal level and really helps you become part of the team. You can encourage innovation in treatment approaches or with patient engagement. This also goes a long way, building that structure and empathy with the patients. You can lead by changing initiatives with trauma-informed care or harm reduction strategies. And you're not just doing the job, you're helping others see what the job can be and really have a purpose. With adaptive resilience, with mental health and substance abuse, the care is really emotionally intense and oftentimes unpredictable. With my background and history, my ability to bounce back from patient crisis, especially with staff shortages and shifts in policy and change, the emotional stamina to handle burnout is really heavy. Grief and secondary trauma that comes along with the substance abuse and mental health background. You have to be flexible to adjust a care plan or the communication style based on each patient's needs. With this resilience, it's not just survival, it's a sustained strength with purpose. Being calm under pressure in a psychiatric emergency or overdose situations or moments of patient aggression, you have to stay calm. It is crucial and very critical. You have to maintain your composure to de-escalate volatile situations. You have to be able to make clear-headed decisions when others are overwhelmed. With my background of 22 years experience, this is more of a learned trait. It comes with experience. It's very hard to deal with sometimes. You have to model emotional regulation for both your patients and your other staff members. The calmness becomes the stabilizing force in chaotic environments, in my experience. Being a pillar of the team helps others rise. This includes delegating with trust and clarity, encouraging autonomy and growth with newer nurses or techs, create space to hear diverse voices in care planning. Not everybody's going to agree. Everybody's going to have different viewpoints, but the same outcome and goal is overall patient care. The empowerment here means lifting others while leading from the beside, not above. With ethical stewardship, this involves advocacy in vulnerable populations. With the ethical stewardship grounded in Huckabee's emphasis on integrity and transparency, I see this as I prioritize ethical decision making, especially in my correctional and substance abuse settings, where the vulnerable populations require advocacy and protection. This principle aligns with the Institute of Medicine's domain of equitable care, which emphasizes that care quality should not vary due to the socioeconomic or geographic factors. With cultural and spiritual sensitivity, working in a pediatric and behavioral health settings has taught me to honor diverse cultural and spiritual backgrounds. Huckabee highlights the importance of inclusive leadership, which I apply by fostering culturally competent care teams. This principle reflects the National Organization of Nurse Practitioners Faculty's person-centered care competency, which emphasizes integrating cultural and spiritual preferences into the care plans. With financial accountability and resource management, as a nursing supervisor in a long-term care and home health setting, I learned to manage budgets, staffing, and reimbursement strategies. Huckabee stresses the need for clinical leaders to understand financial systems to sustain care delivery. This principle aligns with the American Hospital Association's integrated leadership standards, which advocate for collaborative decision-making between clinical and administrative leaders. For my personal leadership story, during my tenure as a nursing supervisor at a substance abuse clinic, I led a team through a sudden regulatory audit. With limited time and high stakes, I organized documentation, delegated my tasks, and maintained morale. The audit passed with commendation, and my team expressed renewed confidence in our leadership structure. This moment solidified my belief in transformational leadership where vision and empowerment drive performance. In my past, I had received feedback from a close peer who I considered a mentor. My mentor once told me, "You lead with quiet strength, and your calm and chaos give others permission to rise." This feedback resonates with Huckabee's concept of resilient leadership, which emphasizes emotional intelligence and stability during a crisis. I feel your ability to communicate effectively will leave a lasting impact on your peers. Effectively communicating involves not only delivering the message, but also resonates within the experience, the values, and emotions of those who are listening to what you have to say, or what you are trying to get across, or what you are delegating also. With leadership goals, I have learned to infuse energy into what you are trying to deliver. This tends to leave a lasting impression. I found that being more positive and upbeat will go further than being negative. One of the goals of effective communication is to motivate your audience. I aim to strengthen my interprofessional collaboration skills, especially in my outpatient behavioral health setting, where coordination with social workers, therapists, and physicians is essential. Huckabee underscores the importance of the team-based leadership in a complex care environment. This goal also reflects on the NONPF's emphasis on the interprofessional and system-based practices. With leadership challenges, a persistent challenge that I have seen is the navigating the hierarchical resistance that I found in the correctional facilities where I've worked, where rigid structures can hinder the collaborative care. To overcome this, I have planned to implement shared governance models. This will promote mutual respect and joint decision making, not only within the medical department, but also with the guidance counselors, the therapists, and the security staff. According to the Agency for Healthcare Research and Quality, leadership that supports transparency and shared accountability improves outcomes and team cohesion. By doing this, you can set feedback, reflect on your performances, and explore new techniques that may be valuable to enhance your goals, set individualized personal goals, and to iterate and to adapt to these goals. Professional standards covered align with the leadership frameworks used in the NONPF core competencies of person-centered care, the AHA integrated leadership principles, and the IOM NAM quality domain specifically of equitable care.